Welcome to Some of Your Parts podcast. I'm your host, Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. Join me as we discuss women's wellness topics and discuss tips and tricks with top elite health experts, and where you'll discover that you're greater than the sum of your parts. On today's show, we'll be talking with world-renowned expert on fibromyalgia, Dr. Rodger Murphree. Dr. Murphree is a board-certified chiropractic physician and board-certified nutritional specialist. He's an internationally recognized fibromyalgia expert. His Murphree Method, a combination of functional and orthomolecular medicine, has helped thousands of patients get healthy and feel good again. He's the author of 3 books for patients and doctors, including Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, Treating and Beating Anxiety and Depression with Orthomolecular Medicine, and Heart Disease, What Your Doctor Won't Tell You. Dr. Murphree is a frequent guest on local and national radio and television programs, including NBC, Fox, and ABC. He writes for several professional and public health-related publications. His articles have appeared in the Washington Post, as well as peer-reviewed professional journals, including Townsend Letter for Doctors and Patients, Chiropractic Economics, Alternative Fibromyalgia News Magazine, The American Chiropractor, and Nutra News. He maintains a busy telephone practice helping patients all over the world get healthy and feel good again. You can learn more about Dr. Murphree at yourfibrodoctor.com. And today we'll be speaking with Dr. Murphree. Thank you for being with us today.
Oh, Betsy, this is great. I'm just, I'm a big fan of yours, and I'm really looking forward to this interview. This is going to be a lot of fun.
I was thinking about fibromyalgia, and I remember years ago, and I don't even know if it's changed, but going through medical training, it was this, first of all, I'm like going back to like the early 1990s. It was this diagnosis where they're like, all right, we can't figure out what's wrong with you, so we're going to say it's fibromyalgia. And I know a lot of people ended up feeling like they were crazy or they were treated like they were crazy. So
Unfortunate, even today, we still have doctors that don't believe fibromyalgia exists. And those that do really don't understand it. They really don't know how to treat it, at least in the conventional sense, in the conventional medical profession. And so a lot of people really kind of fall through the cracks right now, or at the point in the fibromyalgia community that they're really just told, you just have to learn to live with it. It's interesting because I've just finished wrapping up some interviews for the Fibro Summit. And one of the people that I interviewed was Jennifer Lipton. I don't know if you know that name, but she's very prominent in the fibromyalgia space. I think she's one of the spokespeople for the Arthritis Association. But it's interesting because she got diagnosed with fibromyalgia as a medical student and then went on to specialize in fibromyalgia. But even back then, and this has not been that long ago, she said that she really was worried about having that stigma being around her professors and her colleagues, that she really tried to keep it a secret, which is really, that's really such a shame. So it's so sad to hear that.
So what is actually fibromyalgia?
Well, fibromyalgia is a name, really. It's a name given to a group of symptoms that people have in common. So we find that with fibromyalgia, the chief symptoms are insomnia, diffuse, achy, sometimes disabling pain, low energy, brain fog, IBS, restless leg syndrome. There can be some mood disorders associated with it, anxiety and depression. But I think that most people are confused by fibromyalgia because they don't know whether it's an autoimmune disease, it's a virus, it's this or it's that. But I think it's important to point out right away that fibromyalgia is really just a name given to describe a group of common symptoms.
From a diagnosis standpoint, I remember in the past, it used to be like you had to have like 12 points on your body that were sore and you had to have so many of them. And how do they diagnose it now?
Well, you mentioned earlier, so it's really a diagnosis of elimination. And it may take anywhere from 3 or 4 years and half a dozen to a dozen doctors before you ever get the diagnosis. There is a blood test out right now. There's some controversy about it, whether it's going to be accept it all. I think it's moving in that direction where it will be, but typically it's diagnosed after ruling out MS and autoimmune disease, and then eventually they get the diagnosis, and it is based on really the symptoms. They've gotten away from the old trigger points, which you mentioned, 11 of 18 trigger points. They've kind of gotten away from that, and it's really, if you have been struggling for 3 months or more with diffuse aching muscle pain and fatigue, and you've had every other test ruled out, then eventually you're going to get the diagnosis of fibromyalgia.
What do you think like in your opinion, what do you think may be causing this in people?
I believe, and I think we probably would agree on this, is that stress is the catalyst for most diseases. I mean, and in particular in fibromyalgia, we know from the research that shows that these individuals have a heightened over alert nervous system. So their autonomic nervous system is really um, overcompensating for what they're experiencing in life. So they have a central sensitivity pain syndrome. Pain is magnified, and the big reason is because their nervous system is just on overload. And we look at a lot of these individuals. They come from a very stressful household. So as a child, they grew up maybe with verbal abuse or physical abuse, or maybe they just had a difficult childhood, some type of illness, but they lose their plasticity to stress. And as they get older, when they encounter some type of stressful event, or could be even chronic stress, a toxic marriage, or stressful work environment, or surgery, something acute that comes along, that's the straw that breaks the camel's back, and they're never the same again.
Is there something that, I guess I have so many questions. I don't even know where to start. So I'm wondering, like, if somebody's having these symptoms, where do they even start looking into getting help?
Yeah, so if you look at the whole stress model, and we look, and you could, again, I do, so many illnesses are driven by stress, but in the fibromyalgia community, because just genetically, maybe the way God made them, they have an overreacted nervous system that is causing them to experience pain in a heightened way. And they also have a medical condition called allodynia, where their pain threshold is low. So, for you and I, we're able to get a massage, or we're able to hug our partner, or shake somebody's hand. We're able to do these things and not bother us. For those with fibromyalgia, because their pain threshold is low, their pain is magnified. And it doesn't really matter if mutants or riders. It can be from old scar tissue. It can be from nerve damage that is caused either from problems with blood sugar issues, or some type of injury in the past. But there's underlying causes of the symptoms, and one of the big things that is driving the symptoms is a disruption in the body's ability to regulate itself, the hypothalamus pituitary adrenals, the HPA axis. When that gets under too much stress, it can't coordinate with the other systems. It's supposed to, as you know all too well, it's supposed to regulate our sleep wake cycle, our digestion elimination, our endocrine system. It's supposed to be able to monitor and then regulate these different systems in the body. But when it gets under too much stress, it starts to have difficulty doing that. And that's one reason why, Betsy, you just see there's just so many symptoms of fibromyalgia. And I guess that's, one of the big reasons that so many doctors are dismissive of fibromyalgia. How could you have so many symptoms and have normal blood work and look healthy, look fine? How could that be unless you're just a hypochondriac?
It's interesting because as a urogynecologist, I started seeing patterns in people because most of the time they would come to me with pelvic pain. And
Yeah.
so I would start looking into the pelvic pain, and then all of a sudden we'd get into their history. And then, they would start telling me like maybe they had interstitial cystitis, or I ended up diagnosing them with interstitial cystitis. But prior to that, they would be like, oh, some of them would have arthritis. Some of them would have migraines. Some of them would have irritable bowel. Some of them would have TMJ. Some of, like you started to see these patterns and you're like, wait a minute, this is not just pelvic pain. There's something more systemic going on here, and it's got to be connected. So,
Yeah, and I loved your interview that you did with me. That was so great because we talked about interstitial cystitis, which is such a challenging thing. I mean, what a difficult condition to have. But when you combine that with fibromyalgia, it's really, really a challenge. But yeah, I can see how they would come to you because this lower pain threshold, it would cause the interstitial cystitis to be magnified. Um, so yeah, that makes perfect sense, and that's kind of how they interact.
does diet have any role in either the development or the flare-ups of this condition?
So as far as diet, diet is important because we all hear you are what you eat, and that's so true. And I think people get jaded to it. But the thing about diet for those with fibromyalgia, it certainly can play a role. Usually, it's probably more of a minor role over what's happening. And I say that really the only way to feel good again for these individuals is they got to get healthy. And that sounds really simplistic, I know, for those of you who have fibromyalgia, but it's actually very complicated because where do you start? There's so many different symptoms, so many different problems. And changing your diet is important, but the diet is the long game. It's going to take a while before you see results. You can't get healthy if you don't change your diet, if it's unhealthy diet. I mean, you have to do that. But there's some other things that can make a much quicker, more dramatic difference for these people. And that is some of the nutritional deficiencies that they develop either genetically, the way they're made, or just, as you ask, could it be that they've just not eaten well? But we look at some of the amino acids that they're deficient in, or some of the vitamins and minerals that they're deficient in that really drive this illness. And so there's, definitely diet does play a role.
And how did you end up getting interested in fibromyalgia? You didn't wake up
Well,
one day and like, I'm going to be the
you know,
fibromyalgia doctor.
really not to make those with fibromyalgia feel any worse than they may feel, but most doctors don't want to deal with fibromyalgia because it's so complicated, and
Yeah.
oftentimes because they're so understood that when they finally get somebody that will really listen to them, they just dump it all out on you, and you have to be able to take that. And I totally understand that. I'm not saying that that's a bad thing, but for most doctors, if you've got 5 or 10 minutes per patient
Yeah.
and you encounter some fibromyalgia that's got a laundry list of things that have never really been dealt with for a number of years, that's a real challenge. But so having said that, no one would choose fibromyalgia. It chose me. As a chiropractor, I was happy to have a really busy practice. I mean, working with patients with migraines and disc problems and musculoskeletal problems. But I got interested in functional medicine, looking at how well or how poorly the different systems of the body work, and then trying to optimize those systems to help people have optimal health, not just having disease-free health. And that led to starting getting some referrals in the late 1980s, early 1990s. And I had a patient that referred to me as kind of a medical misfit, and she had fibromyalgia. And when Sheila told me all her symptoms, I mean, I thought, okay, she's probably a hypochondriac. But I knew her husband too, and I knew that she was probably just somebody that just wasn't getting any answers. And working with her, just using some of the rudimentary stuff that I was using 20 years ago, she was able to get well in 3 months. And
Wow.
while I could pronounce fibromyalgia back then, I didn't really understand it. I erroneously, naively thought, oh, well, okay, if this is fibromyalgia, then, big deal. And I had been doing research for the University of Alabama Birmingham Hospital in the neurosurgery department for a number of years. And once the word got out that I had helped this one single patient, there was such a void of helpful information and knowledge about fibro. I just started getting all these referrals from some of the medical community here in Birmingham. And Betsy, boy, I tell you, I quickly realized, whoo, what have I gotten into? So I had a choice. I could either just turn them away, or I could try to do everything I could as quickly as I could to learn what is this thing called fibromyalgia and what can I do to help these women, because 98% of those have fibromyalgia are women between the age of 35 and 70. And that led me onto my journey to where, I just started working with them. And when my book came out in 2003, there just weren't a lot of doctors out there talking about it. And so I got invited to conferences all throughout North America to speak. And it just, eventually this got to be, that's just all I did was fibromyalgia.
Now, what is your book called?
So the book is Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. It's in its 5th edition. The 6th edition is set to come out hopefully in November this year. But that book is been I think really, really helpful for a lot of people. Not to toot my own horn, but I think that a lot of the books that are out there, and there's some really good books. Jennifer Lipton's book, The Fibro Manual, who I mentioned earlier, she said that the first book that she read was my book when she got diagnosed. I was really flattered. But there's books out there on fibromyalgia that really, I think, are geared towards learning to live with it. And I don't really believe anybody needs to learn to live in chronic pain, no energy, can't sleep, low moods, all the things that go with fibromyalgia. That's not living. That's just existing. And so the books that are out there, I think, not all, and there's some really good books, but a lot of them are really geared towards people just trying to manage fibromyalgia. And I think that the community deserves something more than learning to manage it. They need to have the opportunity to learn how they can start to overcome it.
And you have a summit coming up too. What's going on? What's the name of your summit, and
Yeah,
what are you doing with that?
that was one of the opportunities to get to meet you. I'd heard about you and had seen one of your podcasts, bits and pieces of it. And so it's thefibrosummit.com. That's where you can find out more about it. But I gathered over 24 of leading functional medicine health experts from around the world, including yourself. And you did a great job talking about interstitial cystitis, which I think can really cause a lot of people the challenge to find anybody, number one, that really understands it. And I thought you did a great job.
Thank you.
But it's thefibrosummit.com. And on the summit, I brought together people that have knowledge about an assortment of different things that would help those who are just trying to get healthy. So one of the big things is deep sleep. Those with fibromyalgia really struggle with your sleep. And if you're not going into deep restorative sleep, you're really not going to feel good. We have experts that talk about that. We have experts that talk all about thyroid, so Hashimoto's thyroiditis, the autoimmune disease, and then also just about hypothyroidism, adrenal fatigue. We talk about gluten sensitivity, food allergies, leaky gut, all the things that you as a functional medicine practitioner that you share on your podcast. We brought all these together, but then to focus all that on how the person with fibromyalgia can take that information and then start to fix the underlying causes of their symptoms, not just merely treat the symptoms. With fibro, you really want to find and fix the underlying causes of your pain, causes of your low energy, causes of your irritable bowel. And that's really the only chance you've got to get your life back.
That's, I think, one of the things that's so frustrating, because I think combination, the medical education, because we just don't have a lot of information, but I think that that has failed doctors and thus patients, because a lot of doctors don't understand it. And then you get into that especially in the allopathic world, which are MDs as opposed to chiropractic doctors and osteopathic doctors. But, and I'm not bad mouthing the MDs, but it's part of their training is that they become very segmented in what they do. And so, you go to somebody, I joke around, you go to a doctor for your pinky finger, they're just going to look at your pinky finger and not say, hey, maybe there's something else going on in the rest of your body that's causing the symptoms in your pinky finger. And that I'm sure these patients with fibromyalgia end up at like 10 million different doctors because they got one for the stomach, they got one for the headaches, they got one for the joint pains. Is there something that the patients, because I think a lot of times, especially nowadays with the way the medical system is and people are kind of being rushed through and it's like this assembly line, is there something that the patients can do proactively to kind of, I guess, find the proper care or get everybody talking together?
Boy, that's a good
I
question.
know it's a loaded question.
Very fair question. It's such a challenge because I think that most doctors don't want to deal with them. And I hate to say that. It's terrible.
Yeah.
And in
I
the
think it's because they don't know. And, a lot of times, and especially when you're dealing with certain personalities, there are those doctors that are like, I am the doctor and I'm all knowing. And you challenge them, they don't know something, they get panicky and you like tune it out. So,
Yeah, and I think it's frustrating for the conventional medical system, doctors, as well as some of those that are doing functional medicine. But in the conventional practice, it's really about, getting a diagnosis and then covering up the symptom most of the time, not always. And I'm not bad mouthing conventional medicine or drug therapy or surgery. Thank goodness we have them. Oh, my goodness. But for the fibromyalgia community, it just doesn't work. They get on this medical merry-go-round where they go to one doctor after the typically put them on a medication that's helped their other patients, to get their life, manage the symptom. But for the fibro patient, you've got so many symptoms that if you're not careful, you got a drug to put you asleep, a drug to wake you up, a drug to speed you up, a drug to slow you down, so before you know it, they're on half a dozen to a dozen drugs and they don't work, at least not long-term. And so what has happened over the years is that doctors have come to the false conclusion that since the drugs don't work for fibromyalgia, and it can actually make it worse, they've just given up because they don't really realize, like the way that you and I practice, it's not about putting them on a drug to reduce pain like an opioid. It's really about finding out, okay, why do they have this pain? What's driving this pain? What can we do to help them so they don't have so much pain? And one of the best ways to do that is to raise that pain threshold. So if we can raise the pain threshold, we can lower the pain. And there's definitely functional medicine therapies that can definitely raise that pain threshold. That's something that conventional medicine really doesn't talk about.
can you give us an example of some of those therapies?
Absolutely. So, one of the things that probably the most important thing for those with fibromyalgia is they're low in serotonin.
Mm.
So, serotonin is the happy hormone. The higher your serotonin level, the happier you are, less anxious you are. But also, the higher your serotonin level, the higher your pain threshold, because serotonin blocks a hormone called substance P. And I know you know all this, but the serotonin helps to block this hormone that will lower your pain threshold and magnify pain. So one of the best things we can do for those with fibromyalgia is to get their serotonin level up. Now, in the conventional medical practice, it's typically about using antidepressants.
Yeah.
There's definitely a place for that. I mean, there's definitely a place for antidepressants. But unfortunately, if you look at the data, number one, nobody has an antidepressant deficiency. So, and we look at the studies that show that 70% of the time that an antidepressant is no better than a sugar pill. And
Wow.
there's a time and there's a place, and thank goodness we have them. But in the fibromyalgia community, what we see is if you're using a selective serotonin reuptake inhibitor and there's nothing to reuptake because they've just gotten so depleted in serotonin, then that medication is not going to do anything, or at least eventually it's going to quit working.
That makes sense.
So ideally, what we want to do is, instead of using an antidepressant, which is like a gasoline additive, right? But but these people are running on fumes. What we want to use are the building blocks that make serotonin, which come from, as you talked about the diet, comes from tryptophan, an amino acid that's in protein that then turns into 5-hydroxytryptophan, that when combined with B vitamins, vitamin C, and magnesium, that's where serotonin comes from. So in my practice, the Murphree Method, first thing I do is make sure that I get my patients taking 5-HTP, a good multivitamin, to raise that serotonin level. And then as we do that, as that serotonin level goes up, we see that their pain threshold goes up and their pain goes down. It also has the effect of calming them down if they have any kind of anxiety issues. Helps with moods. It helps with IBS. Uh,
Yeah.
you have more serotonin receptors in your intestinal tract than you do in your brain. Um, that's why you get nervous. When you get nervous, you get butterflies in your stomach. So with IBS, serotonin helps to regulate the motility, how fast or how slow food moves through your digestive tract. So serotonin is super, super important part of raising that pain threshold.
And that's going to be a little bit difficult too, because I'm wondering, we have so many of us have leaky gut from the poor diet.
Mm.
And so now you're trying to increase the absorption of these things. So you got to kind of work on things from multiple areas.
Yeah, you do, and I think that's what is the difficulty for those with fibromyalgia and those who really want to try to help these individuals. There's so many different problems. Where do you start? And,
Yeah.
and so I've broken it down into 4 key areas for people. Really, I think that's called the Murphree Method to jumpstart their health. And number 1 is deep restorative sleep. I mentioned that earlier, because if you're not getting deep restorative sleep, you're going to have more inflammation. We know if you're not sleeping, you increase your inflammatory chemicals by 40%. Obviously, you're not sleeping well, you're going to be tired. And these individuals hadn't slept well in years. If you're not sleeping well, you're going to probably have some mental clarity issues. I mean,
Yeah.
anybody that's not sleeping well is going to have trouble with their mental clarity. And then it also drives restless leg syndrome and irritable bowel and low moods, and can compromise your metabolism, so it can affect your thyroid. And so many things are tied to a good night's sleep. So number 1 is that deep restorative sleep. Then number 2 is saturating your cells with high doses, but the right doses and combinations of vitamins, minerals, amino acids, and essential fatty acids. People kind of get jaded to, oh yeah, take a good multivitamin or take supplements for this, because they've tried to do it on their own.
Yeah.
That turmeric is good, or CoQ10 or resveratrol, and those are all healthy things to do. But there's some things that have to be done, and you have to saturate the cells. You can't do it with a Centrum Silver or one a day. You can't do it on something based on the RDA, the recommended disease allowance.
Yeah.
It's to keep you from getting scurvy or beriberi. It's got to be these high doses, because we're biochemically, we're as different on the inside as we look on the outside. For one person, if they took 200 milligrams of magnesium, they would be in the bathroom all day, loose
Yeah.
bowel. Another person, it may take 1,200 milligrams of magnesium to relax their tight, aching muscles and their tight colon, so they'll have a normal bowel movement. Number 3 is adrenal fatigue. So with fibromyalgia, they have caused their stress coping glands, the adrenal glands, to be compromised over the years of having this stress. And so they don't have the cortisol or DHEA where it needs to be able to have the stamina and resiliency to stress. And stress becomes more magnified. So bright lights, loud noises, things that you and I wouldn't think anything about, it just drives them crazy because they can't handle that stress. Then number 4, finally, is you got to fix the gut issues.
Yeah.
Because as you know, trained in functional medicine, I mean, that is the window to everything. You've got to fix that. 70% of those with fibromyalgia have IBS or reflux or GERD or leaky gut. They have something wrong with their intestinal, with their ability to digest and then properly eliminate their foods that they eat. And if you don't fix that, then you're so right, Betsy. You got leaky gut, you got SIBO, you've got all these things that can show up that just fuel the flames of these symptoms that we associate with fibromyalgia. And if you don't fix those, you're not going to fix the underlying causes of those symptoms.
Those are some really good points. I really like, and nice and easy in 4 things nice to remember.
Yeah.
Is there something that I haven't asked you that you can think of that you want people to know about fibromyalgia?
Well, I think, probably the most important thing is that you can feel better. I mean, don't give in to the doom and gloom of you have to live with it. Now, everybody's different, and there's limitations, but there's no reason why you can't feel better. You just need to find somebody that really can help you navigate this thing called fibromyalgia. Oftentimes people will go to a functional medicine doctor or integrative doctor, and that doctor the first thing they want to do is put them on bioidentical hormone replacement therapy. And there's a place for that, no doubt, no doubt. But that's usually usually what I see is that doctors that are not trained in fibro and really spend a lot of time with it, they tend to put the cart in front of the horse. It just does, in your practice, you've probably seen traumatic changes for your patients when you put them on bioidentical hormone replacement therapy. My wife is on bioidentical hormone replacement therapy, so I'm not knocking that. But in fibro, if you don't get the 4 things that I just mentioned, if you don't get those right, then you can't even put the rest of the puzzle together. And there's definitely other pieces. You can have a problem with your thyroid. And many of them do. Probably about 65-70% of people I work with have a problem with their thyroid that's never properly diagnosed or properly treated. But if you don't get these four things, then you never get the corner of the puzzle. If you ever put a puzzle together, the strategy, just if you can just get the corner, then it makes it easy, because you can take all these pieces that are sitting out on the table and you can start to build from the corner. But if you don't ever get the corner right, then you're just lost, because you've got all these random pieces, and it's just so difficult. So I would say that
I'm going to steal that metaphor. I really like that. I'm going to steal it. I'll give you credit, but
I'm big in analogies and metaphors. But I think that if you're open to the idea that if you can find the right information, which we're going to share on the summit, you'll see that you're probably not as far off as you think in being able to make some dramatic improvement. Now, that doesn't mean you're cured. I don't think you get cured of fibro. But having said that, you can get your life back. You can control fibromyalgia instead of it controlling you.
Yeah, that's a great point. Where can people find your book?
Well, the book is sold out.
Get it used, or wait for the next edition.
It's a good thing and a bad thing. So the 6th edition's coming out, and but it's available on my website. The ebook is, and it's yourfibrodoctor.com, and there you'll see there's all sorts of free resources about the Murphree Method and the Jumpstart things I talked about those 4 things. There's all kind of free videos on there. And so I encourage you, if any of this resonated with you and you want to know more, I would encourage you to go there and just take advantage of all the free material that's there.
And then also you have the summit very, very soon, right around the corner. So
I want to encourage people to check out the summit. Dr. Greenleaf, she's she's amazing. And she did a great job on that interview. It's one of my favorite interviews on the summit. But it's thefibrosummit.com, and I'm sure you'll put it in your notes too. The people
definitely
through there as well. Yeah.
Oh my goodness. Well, thank you so much for being with us today and being so informative.
Oh, this is great. I mean, for the last 20 years, I've been on a mission, to help those with fibromyalgia live healthier, happier, more productive lives. And anytime I get a chance to come on a program like yours and get to share something that may help these individuals, it's really a real treat. So thank you.
Today's episode was brought to you by the Pelvic Floor Store, your source for personal health. You can find us at www.pelvicfloorstore.com. For more information on today's episode and women's wellness, please go to drbetsygreenleaf.com.